You say that choosing the implant is very important to creating a natural looking breast. So what are some of the options? And what's new?
Yeah, sure. So in terms of choosing the implant, first of all, you have to choose an implant that fits your body. So the base width of the implant is critical. If you're only this big, it's not great to have an implant that big. You know what I mean?
Okay.
So you got to fit an implant that matches your body. Okay. And then with what's happening nowadays, implants have evolved a lot. Okay. We originally used to have saline implants, which were saltwater bags, and they kind of felt like a saltwater bag. You know, then we had silicone implants that felt great, but then, you know, there was all these issues of leaking and all this sort of stuff, and that's changed now as we've come into implants that are now solid and cohesive. So they are silicone, they feel gummy, they have the benefits of feeling very soft and natural, like real tissue, but if you cut them in half, they're like a gummy bear, and they just don't leak. And that's a cohesive gel implant technology. And then the next kind of generation that's gone from there is the thinking of implants has changed. It used to be implants were very soft and your breast shaped the implant. But the reality is a lot of women who want breast augments don't like the shape of their breasts. So if you let the breast shape the implant, it's not going to work as well. So now we've come to more of thinking of what's called form-stable implants, and that the implant itself is shaping the breast.
Interesting.
And that's where you get the sort of the next generation of the anatomical shaped implants. So anatomical shaped implants, and we've got a lot more of them available worldwide than we'd have in the US. And having operated outside the United States, I've had the privilege of being able to work with some of these implants, but form stable implants are able to shape your breast, and you can get them in higher fullness up top versus more fullness on the bottom versus more width versus more projection.
Is this better for the thinner woman?
Well, it's better
These
for a
shaped
lot
implants?
of. Well, it's customizable. So it's really, you can actually customize it to your body shape. So someone who's thin and is really hollow up top and needs some fullness up top, you can get a higher height implant. Someone who's kind of very wide, you can get a wider based implant. And if they already have a lot of fullness down on the bottom and they love vertical height, you can go wide and keep it a short height implant. So you can adjust kind of the shape of the implant to the person's body, which is the advantage of anatomical implants. And because they're form stable, meaning they're a little bit stiffer and they'll actually push the tissue, they will shape the breast tissue.
So you like these formed implants?
Yeah, they're actually, the concept is
because not a lot of
nice.
guys do them, right? Is that correct?
Well, it's relatively new to the United States, so not a lot of people have gotten into doing them, and then there's a whole learning curve to using them. I mean, putting in a round implant, it's like putting in a round ball, right? People have gotten used to that. I've done 10,000, 15,000 breast augments that way. I mean, we've all done them, and so putting in a round implant is very easy to do. But now you're putting an implant that's shaped, it's, and some are higher and some are lower.
Like a slope? It has more of a slope.
Yeah, it has a
at the
little
top?
slant on the top, so
Okay.
you can get the slant to be more slanted or less slanted, depending on what shape you want. So now it takes a lot more planning and thinking of how to use that implant than just putting a round ball in.
So do you believe that you should choose a surgeon that has experience in using these type of implants?
Well, I think, yeah, you should have a surgeon that is willing to not just do the same surgery that he does all the time on every patient, but is willing to adjust the surgery to meet the needs of the patient's body and what the patient expects. So that's the advantage of these implants, because there are people that just a round, simple implant is just not going to give them what they want.
Okay.
It may give them too much sharp edge up here. You know what I mean? That round ball edge that doesn't look natural. Mm-hmm. And in that situation, you may want an implant that's sloped a little better. And you may want an implant that either has a little more projection because they have too much sagging and they need to pull that sagging up. Right?
Do most women know this, or they don't know this, that there's these options? Obviously, I don't know this.
No, I think these are the options that really you get into when you're into consult. Most people don't come in.
So the women don't know this stuff?
No, women come in just saying.
Interesting.
Most women come in saying, I want a breast implant, and they don't even know why. Well, they know they don't like their breasts, right? And some of them, a breast implant is not what they need. They just need a breast lift,
Okay.
right? So some of them don't even know that, but they know that they don't like their breasts, and they know they want them better, and they know what they want them to look like, right? And then the question is, how do we get there? And that sometimes that is a lift, sometimes that is an implant alone, sometimes it's a lift plus an implant, Sometimes it's a round implant. Sometimes it's a shaped implant.
So these shaped implants, you know, I've done some research after talking to you, and they're not that much more. I mean, it's very little. I mean, it's not that much more than a regular implant, right?
No, I mean, realistically, I mean, why would they be much more? It's just a different shape, right? The manufacturing isn't
all
different.
plastic surgeons using them if you say it gives you a better look, a more natural look?
It's just a learning curve to doing it, and it's technically a little more challenging.
Okay.
And I think that actually, sometimes doing something new and pushing yourself to doing something a little more technically challenging, when you've done it this way for years and years and it's kind of worked, you know, a lot of people don't want to make that leap. And I think, again, that's part of progression and growth and pushing yourself to the next level and making yourself a better surgeon. And so that's why I think it's very important to go do that, but it doesn't mean everyone does that.